The poster title is Using the ICF Check-List in the Functional Assessment of Individuals Living with Deafblindness. The authors are Walter Wittich, Tosin, Omonye Ogedengbe, Atul Jaiswal, Shirley Dumassais, Ricard Lopez, and Meredith Prain. The affiliations for Wittich, Ogedengbe, Jaiswal, and Dumassais are the School of Optometry, Université de Montreal, and the Centre for Interdisciplinary Research in Rehabilitation of Greater Montreal, in Montreal, Quebec, Canada. The affiliation for Lopez is the European Deafblind Network, Barcelona, Catalonia, Spain. The affiliation for Prain is Able Australia, Surrey Hills, and the University of Melbourne, Parkville, Victoria, Australia. Individuals who live with deafblindness benefit from interdisciplinary care, yet they do not necessarily have access to the appropriate health and social services. This absence of services could be linked to a lack of understanding of how the complexity of deafblindness affects functioning. The development of the World Health Organization's International Classification of Functioning, Disability, and Health, or ICF for short, core sets, describes functioning in the presence of complex health conditions by considering its biopsychosocial implications. The current cross-sectional multi-centered study is the final of 4 mandated phases for the development of core sets for deafblindness. The aim of this study was to identify the most frequent functional barriers and facilitators experienced by persons living with deafblindness, as reported during a standardized clinical assessment of functioning. We conducted a cross-sectional study in a global multi-centered clinical setting with 29 individuals living with deafblindness across the 6 regions of the World Health Organization. We conducted clinical evaluations of the biological and functional experiences of individuals with deafblindness during a semi-structured interview following the ICF Check-List. Questions explored body structures, body functions, activity limitations, participation restrictions, and environmental factors. Participants' responses to each ICF category within the checklist were recorded using the associated ICF qualifiers and analyzed using descriptive statistics. The predominant ICF categories of body structures were related to the eye and ear S2, resulting in impairment of seeing B210 and hearing B230 functions. The ICF categories related to listening D115, communicating with receiving nonverbal messages D315, and driving D475 were reported with severe difficulty. 16 environmental categories were recognized as facilitators, for example E310 immediate family, 4 as barriers, for example E225 climate, and 12 were identified as both facilitators and barriers, for example E330 people in position of authority. The effect of deafblindness on functioning and social participation is highly heterogeneous. Professionals need to look beyond the medical aspect of impairment during the evaluation and management of individuals with deafblindness. Holistically, understanding the complexity and heterogeneity of how deafblindness affects day-to-day activity is crucial for an appropriate management plan, referral, and for well-being to be achieved. Strengths and limitations of this study. The data include representation from all 6 regions of the World Health Organization, thanks to recognition by international partners of the importance of ICF core sets. Combining the perspective of clinical functional assessment with an analysis of responses based on lived experience of deafblindness brings new insights into the complexity of this condition. Reducing the assessment criteria to the existing codes included in the ICF checklist may bias the outcomes towards predetermined ICF categories and codes. While remote assessments facilitated participation and accessibility of the interviews for persons with deafblindness, in-person evaluations may provide richer insights into nonverbal components of client-clinician interactions. This project and its consensus conference has received research funding from the Canadian Hearing Services, the FRQS Vision Sciences Research Network, the Centre de Recherche Interdisciplinaire en Réadaptation du Montréal Métropolitain, the Diputació de Barcelona, Deafblind International, and the Deafblind Ontario Foundation, with partnership funding from the Institut Nazareth et Louis Braille, du Centre intégré de santé et de services sociaux de la Montérégie Centre and the Centre de Réadaptation, Lethbridge Layton Mackay, du Centre intégré universitaire de santé et de services sociaux du centre-ouest de l'île de Montréal.